As soon as she entered the hospital, medical staff were gasping for air, collapsing on the floor. Dozens fell sick just by being near her. The hospital itself turned into a disaster zone. So, what really happened on 19th February 1994? Riverside General Hospital in California. A 31-year-old woman named Gloria Ramirez arrives in the emergency room by ambulance. She's conscious but struggling to breathe. Her family already knows she has advanced cervical cancer. The paramedics report that her pulse is racing and that her breathing pattern looks very unstable. In the ER, she is quickly given standard emergency drugs to calm down her heart and ease her breathing. But what happens next will change everything. As doctors prepare to use a defibrillator, several staff members notice something strange. Gloria's body appears to have an oily sheen. There's a strong, sharp odor in the air. One nurse says it smells like ammonia. Another describes it as garlicky. When a syringe of her blood is drawn, a chemical-like scent fills the air, and small yellow-brown particles are visible inside the tube. A nurse suddenly feels lightheaded and collapses. A medical resident complains of dizziness and staggers out of the room. A respiratory therapist drops to the floor. Panic spreads fast. Within minutes, nearly everyone treating Gloria starts feeling ill. The emergency room calls an internal emergency. Patients are evacuated to the parking lot. Only a small team stays behind, wearing masks to continue CPR. After 45 minutes of effort, Gloria Ramirez is pronounced dead. By then, 23 hospital workers had fallen ill. 5 of them were hospitalized. 1 spent nearly 2 weeks in intensive care. Hospitals deal with strong smells and toxic chemicals all the time. Disinfectants, body fluids, ammonia, and even chemotherapy drugs. But medical staff does not collapse just from being near a patient. That was very unusual. So that night, a hazardous materials team was called to sweep the ER. They checked for hydrogen sulfide, which is sewer gas, and other industrial poisons that can make people faint or burn their lungs. The readings came back negative. No dangerous gases found. That's good news for safety, but terrible news for figuring out what just happened. The mystery only deepens from here onwards. Because of the horrifying mystery, the coroner's office seals off Ramirez's body and orders an autopsy under strict precautions. Technicians wear airtight suits. Samples of air from the body bag, tissue from her organs, and fluid from her bloodstream are all sent for analysis. Weeks later, the coroner ruled that Gloria Ramirez died from natural causes, specifically heart failure caused by kidney failure linked to her cancer. That explains her death. The chaos she caused among everybody around her still remained unexplained. The California Department of Health sends 2 doctors to investigate what happened in the ER. They interview all the staff looking for patterns like where people were standing, who handled the blood, what symptoms they felt, and so on. Their findings were that the people who got the sickest were mostly those who were standing the closest to the patient, especially women who handled blood draws, IV lines, or those who were directly at the bedside. Yet when their blood samples were analyzed, every test came back normal. That's when the investigations proposed something most staff did not expect and maybe didn't want to hear: mass psychogenic illness. In simple words, it means symptoms that spread through a group not because of a poison or a gas, but because of fear and extreme stress. According to them, here's how it all went down. The staff, already tense and exhausted, might have experienced a stress-induced chain of fainting and nausea triggered by the smell and the shocking situation. Some hospital administrators were relieved. After all, it meant there was no chemical disaster. But several of the staff who collapsed didn't buy the mass hysteria explanation at all. especially the ones who were seriously injured. One resident, for instance, developed long-term breathing problems, hepatitis, pancreatitis, and even avascular necrosis. That's when the bone tissue in the body dies due to lack of blood flow. She ended up on crutches for months. Another nurse suffered from repeated episodes of apnea, temporary pauses in breathing long after the event. These are not symptoms you can just think yourself into having. They insisted that something real made them sick. So the case took another turn. The Riverside County Coroner's Office brought in outside experts, scientists at the Lawrence Livermore National Laboratory, one of the most advanced forensic labs in the US. They begin by retesting tissue and blood samples from Gloria's body. This time, they found something unusual: large amounts of a compound called dimethylsulfone, abbreviated DMSO2. How did DMSO2 end up inside her? We'll get to that later. For now, we need to understand where this compound actually comes from: dimethyl sulfoxide, or DMSO. DMSO is a solvent that some people use as a pain reliever, even though it's not an approved medication for cancer. Back in the 1960s, it was studied for its ability to penetrate the skin and carry drugs deeper into the tissue. Some cancer patients used it at home to reduce pain. Gloria's relatives also later told reporters that she had been using home remedies to ease her pain. DMSO has two telltale traits. It gives the skin an oily appearance and gives off a garlic-like odor, exactly what the ER staff had reported. The Livermore team asks a simple question: if Gloria Ramirez had been using DMSO for pain, could the emergency procedures, maybe the oxygen, the drugs, or the defibrillation, have turned it into DMSO2? Their answer becomes one of the most famous chemical hypotheses in forensic medicine: a step-by-step chain reaction. Step 1. Gloria had DMSO in her system, likely from using it on her skin for pain relief. Step 2. When she was given oxygen and her body went under severe stress, some of that DMSO was oxidized into DMSO2, exactly what the lab found in her tissues. Step 3. DMSO2 can crystallize at cool room temperatures. That explains the tan, or the manila flecks, seen in her blood sample. Step 4. Under rare conditions, DMSO2 can transform further into dimethyl sulfate, a highly toxic gas that irritates the eyes, lungs, and nervous system even in small doses. Now, there were also chemists who pointed out that creating dimethyl sulfate requires specific lab conditions, not something you would expect to happen inside a human body. Others noted that no actual traces of dimethyl sulfate were found in the remaining samples. But the Livermore scientists countered that any dimethyl sulfate would have been unstable and could have broken down before testing. They argued that the compound might have existed briefly at the scene, but vanished by the time samples reached the lab. So the debate continued. As for Gloria, officials kept her body for more than 2 months due to the ongoing investigation. The family protested, calling it cruel and unnecessary. They also rejected the idea that Gloria herself had somehow caused the staff's collapse, saying she was being blamed for something she couldn't control. Her funeral finally took place in April 1994. By then, the case had become a national story, and she was nicknamed the Toxic Lady. Could this ever happen again? In theory, the conditions that night were so rare, they're almost impossible to recreate. You would need a patient with high DMSO levels in their body, a cool environment, oxygen treatment, and maybe even an electric charge like defibrillation to set off that final chemical step. That combination is 1 in a million. That's why you haven't heard of another Gloria Ramirez. Gloria Ramirez's case also shows how medicine and science deal with uncertainty. Doctors and scientists hate not knowing, but sometimes the data just doesn't add up.